I want to tell you what to expect today. So I want you to know that before we do anything, we're going to give you lots of numbing drops so that you're nice and numb and you don't have pain. We'll bring you into the laser suite next door, and during LASIK, you're going to be laying flat on a laser bed. And we use an eyelid holder to keep your eye open so you don't have to worry so much about blinking.
Okay.
As you know, LASIK uses two lasers. The first laser makes your flap, and then the second laser reshapes your cornea. To make the flap, the laser uses a suction cup.
Okay.
When the suction cup's on your eye, you're going to feel pressure like it's grabbing your eye.
Okay.
And because of that pressure, your vision gets dim and it actually often goes totally black.
Okay.
Now, I don't want that to freak you out because that's totally normal.
Okay.
So if you squeeze your eyes or look around, the suction cup can pop off.
Okay.
If the suction cup pops off while it's making your flap, it's not the end of the world, but we would just stop, we let you heal, and we try again in a couple months.
Okay.
After the flaps are made, we'll move you to the second laser. This time what you'll see is a green flashing light, and I'll just keep reminding you to look at the green light.
Okay.
Gently we lift the flap, and then before we treat you, I'll warn you. I'll say, okay, on the count of 3, please look at that green light. 1, 2, 3, and then you hear a buzzing noise, which is the laser, for about 10 seconds.
Okay.
Try really hard just to look at that green light so you get a nice centered treatment.
Okay.
Do you have any questions for me?
I don't think so.
Okay, you don't have to memorize that because
Okay.
I'm going to talk to
You're
you the
gonna
whole
okay.
thing. Okay. Good. Your flap is nice and smooth, no wrinkles, it looks well aligned. Yeah, you look perfect. All right, congrats. So right now you have like 10 numbing drops in your eye and you probably feel okay, but on the drive home, they're gonna start to wear off and it's gonna feel like you just had eye surgery. Your eyes are gonna burn and sting like crazy for usually like 4 to 6 hours. Don't let that freak you out because that's normal.
Okay.
Some patients will go home and take a short nap, like a 2-hour nap, to sleep through the worst of the sting. Eventually, those flaps will get very sticky and they'd be hard to move, but in the beginning, they're fragile. So if you accidentally rubbed your eye, you could wrinkle it or dislocate it. Okay. In which case, you know, of course, I would fix it for you, but I don't want you to have to go through that. So
Right.
just be really careful and wear your cool goggles.
Definitely,
okay?
yeah.
Do you have any questions for me?
I don't think so.